Hello, thank you for joining the latest one-on-one episode, a video series from Modern Healthcare Custom Media featuring insights from leaders from across the industry. I'm Maria Castellucci, a content strategist here at Modern Healthcare. It's my pleasure to be speaking with Dr. Christine Gall, Director of Healthcare with T-Mobile for Business. In this role, Christine brings extensive clinical, quality, and operational expertise. She describes this role as an opportunity to impact the health of the nation. With the U.S. healthcare system facing so many challenges, Christine engages in conversations with healthcare colleagues aiming to connect consumers to medical care and services through innovative technology and care delivery. This has inspired Christine to further address disparities in healthcare access, specifically for the at-risk and underserved, and she aims to leverage the vast resources and capabilities of T-Mobile to do so. Today, Christine will be sharing how healthcare organizations can be reimagining and innovating how they connect and care for their patients and communities by deploying 5G. Before we get started, I want to thank the sponsor of this video, T-Mobile for Business. T-Mobile is providing a powerful 5G network that enables healthcare providers to expand how they think about care in a digital age and deliver reliable, connected care to any part of the country. Christine, thank you so much for being here today. I'm really excited to be talking to you.
Maria, thanks. It's my pleasure.
Okay, so let's dive in. So as digital transformation in healthcare is accelerating, the demand for faster and more reliable connectivity is really important. But why can't current solutions such as Wi-Fi and wired networks meet the new realities of digital-first healthcare? Can you talk about that?
Sure. Great question, Maria. Hospital structures have typically been built to withstand extremes in weather conditions and are designed to mitigate emergencies such as in-building fires by the creation of fire compartments. And this infrastructure can pose an incredible challenge to reliable in-building coverage. When you think about enterprise Wi-Fi networks and wired networks, there are several limitations. For Wi-Fi, the greatest limitation is in capacity. Oftentimes you have patients, visitors, and the staff competing for Wi-Fi bandwidth, and that poses a challenge. There's also limitations in security and in mobility with Wi-Fi. When you look at wired networks, the major challenges include limited mobility. They only extend as long as the wires reach. And if there's an interest in expanding that wired network, it is quite costly. So another issue is that as technology advances, the hospital ecosystem is home to a growing number of connected devices that rely on the network. Like a freeway system, the more cars, the more congestion. So the same is true for hospital networks. The network must be able to manage congestion in the pipeline so that doctors, nurses, and other members of the healthcare team can maintain constant access to the patient record, to historic and current patient data, and be able to manage order entry as well as documentation to continue the plan of care. Also, as the number of patients have reached out and have accessed virtual care during this pandemic timeframe, and to the tune of 38-fold time increase in the number of people that accessed virtual care pre-pandemic, this is another issue that can pose traffic congestion basically in the healthcare pipeline. Another issue that's of top concern is security. Security remains a top priority for healthcare systems. And as more entry points to the network are added due to what I just mentioned earlier, and as connected devices become increasingly mobile, transitioning from the hospital to external networks and then back, network security is a critical concern and has the experts responsible for maintaining data security always on point to address the next potential threat. And last, the challenges facing healthcare providers and systems today are really truly complex. T-Mobile is poised and well positioned as a trusted partner to solve for these and other challenges to top quality care delivery, and I'm happy to talk about those issues today.
Thanks, Christine. That's a great segue to my next question. So, in what ways does 5G provide the capabilities beyond the current solutions in healthcare and their limitations?
5G provides a highly secure wireless connection, And this comes with high speeds and low latency. Latency means lag. So the lower the latency, the less delays or lags you're going to see in the system. 5G can also handle huge data files handily. This feature alone opens the door for incredible innovation in healthcare delivery. Let me give you an example. Historically, a person's ability to access a specialist that was an expert with their particular condition often depended upon the zip code they resided in. 5G can connect a neurosurgeon in Boston to a patient experiencing a stroke in Boise, where the surgeon can review films, review test results real time, direct care, and ensure that the best practices are followed. This truly wasn't feasible prior to the evolution of 5G. And in fact, we're doing something similar. We're in ongoing conversations with the neurosurgeon in the Pacific Northwest, where he wants to outrig an ambulance as a mobile stroke unit so that providers can actually begin to treat a patient once the films are read. So this is the sequence of event. Patient comes into the ambulance, they get a CT of their head. The film is automatically transferred to the neurosurgeon, who can close to real time read those films, determine where the needs are, and then determine whether or not they can begin treatment directly in the ambulance. So that can certainly reduce any of the complications of a stroke by starting care quicker. Also, when combining 5G with technology like edge computing, and edge computing moves storage and data analytics closer to the end user, which further improves the speed and the reliability and the lower latency of the file transfer. This improves care further. When you add to that the idea of adding artificial intelligence, where those large streams of raw data can be systematically analyzed through complex algorithms, and those raw data can be transported and transformed into meaningful, actionable information to the provider. The provider's ability to respond quickly improves greatly. So that's another incredible benefit of 5G and how it impacts care.
That's really interesting. So I know mentioned in my intro that you're really passionate about how technology can expand access to care. So can you talk about the promise of 5G to expand access to care specifically for vulnerable populations and how T-Mobile is working to make that a reality?
Maria, you're speaking my language. Thanks for asking that question. You know, as a leader in public health, this is a critical turning point to improving accessibility to care for all. Mobility or mobilizing healthcare is critical to that because it reduces healthcare disparities gap by improving access to timely, top quality care for all. The example that I mentioned earlier about doesn't matter what zip code you're in, if the specialist is in Boston and you're in Boise, you can still this connectivity allows you access to the best services available. Let me give you a few other examples. Diagnostics and treatments can be brought to patients where they work and where they live. No longer does somebody have to navigate if they don't have reliable transportation to get in to seek care. So that can reduce delays in care, which can improve outcomes. Mobile rehabilitation services are another area of opportunity. You know, as all industries, including healthcare, are addressing reduced numbers of employees, we have to figure out how to do more services, provide more services with less staff. And rehabilitation is one of those opportunities. So imagine the physical therapist is in their office and managing going remotely into 6 virtual rooms, monitoring 6 patients simultaneously and how they are doing their exercise regimen, tracking how they're doing along their goals for their plan of care, giving them real-time correction. And there are solutions, technology solutions that aid in this. I work with one provider who actually has enabled a garment with GPS that can then collect data and send it to both the patient and the provider saying, this is how close you are to the actual movement you want to be achieving in this physical therapy event. So it can give you, again, much more access to information that you can use to actually course correct and improve your rehabilitation outcome. Another area is mobile urgent care. Again, so much of somebody's ability to access care relies upon their ability to get to care. If care can come to them, and there are providers out there today that are just growing dramatically, and the interest and request for this type of service is growing exponentially also. So it's an area that, if you can imagine the future and what that could look like, very different from what it has been historically. 5G is what is enabling those solutions to be powered. On one other extreme, robotic surgery is another area. In the not too distant future, we're going to see much more solutions, surgical solutions that can be done remotely. And robotic surgery absolutely requires 5G for that consistency, low latency, and reliability. Clearly, you can't have a failure during a surgery. And on the other end of the spectrum, primary preventive care is happening today. We have pediatric providers that are reaching out to children in the school system to provide preventive care, primary care, health education, and are even moving into things like therapies and behavioral health support as that becomes such a challenge today. So the opportunity to enable more healthcare solutions is one aspect. Another aspect is that 5G extends the reach and efficiency of the healthcare team. Imagine 5G to be a superhighway that connects patients with their care team. And the more access to timely data regarding changes in patient condition that the care team has, the greater their ability to prevent and minimize illness and injury. And for anyone that's spent any time on call in healthcare, you can relate to the fact that getting that 2 a.m. call oftentimes has meant previously that you have to go into the hospital. But now you can access a patient's record, review their history, vitals, and diagnostics, assess the patient, and develop a diagnosis and treatment plan all virtually, potentially even avoiding the need to travel into the hospital in the middle of the night. From a provider and employee engagement perspective and satisfaction perspective, this option for care can reduce the incidence of burnout in our very valuable hospital and healthcare team.
That was all very interesting. So it sounds like there's a lot of potential with 5G. Before we close out, do you have any final thoughts that you'd like to share?
As I think about the challenges that the pandemic has placed upon us, and where we are with the one battle being the cost of healthcare continuing to rise, 5G is in a place to really manage that. When healthcare teams are better connected to their patients and have real-time access to data, they can identify signals of decline early. They can intervene to prevent or reduce the impact of symptoms or complications. They can reduce high costs of care like ED visits. They can reduce hospital readmissions and improve the overall quality of life. And for me, that's why I joined T-Mobile. The ability to support the creation of care delivery of the future using mobility solutions is truly where healthcare is moving, in my opinion. And I am so pleased to have the opportunity to talk about it.
Well, thank you, Christine. I really enjoyed our conversation and learned a lot.
Maria, thanks so much for the opportunity to speak to this very important and timely topic. Thanks so much to Modern Healthcare.
Okay, and that brings us to the end of this one-on-one episode. We once again like to thank the sponsor of this video, T-Mobile for Business. For more information about T-Mobile for Business, please visit tmobile.com/business/industry solutions/healthcare. To our audience, thanks for tuning in today. Look for more one-on-one episodes in the coming weeks by visiting our website and our social media platforms.